session that we held today was about the advances in PNH, and that was talking about either novel therapies that are available or being underway, as well as potential novel targets to treat patients with PNH. But we also had some important insights in terms of how the disease occurs and what are the potential genetic events that might facilitate that PNH may happen in a patient eventually. So I think that this was a broad overview and very important for physicians to understand the variety of potential therapies for a diversity of patients and how to better choose the better options for a specific or given patients, a more personalized medicine for these, right, Antonio?
Yes, absolutely right. And actually, these are very exciting times for physicians and scientists working in the field of PNH, because the past 10 years were very important to better understand the biology underlying the disease. And of course, this was leading to the development of, let's say, novel treatment. Then, we may discuss whether they are better or not. I think they are. This is exactly what we had the privilege to discuss all together, taking advantage of this huge meeting with all the experts in the same room. Well, the first advice is that the fact that we have more options is very good for patients and physicians. It's very important to understand that we are entering in a new era because we have many novel options which are more or less targeting the same target that we were used to have in the past. So basically, the agents that are called terminal complement inhibitors, but we are also approaching a new era with agents which are completely different in their target, and they potentially may really improve the outcome in terms of hematological response and possibly other outcome for patients like quality of life. So it's very exciting that we have all these different options. We cannot go into the details biologically speaking, but both physicians and patients have to be aware that there is a lot of science behind these treatments. And of course, we perfectly know how and why we have arrived to these new treatments. And we know that all these options may lead to better care for patients. Of course, it's very important that we fully understand how we have to use these treatments now and even better tomorrow.
Yeah, so Antonio pointed out very wisely that we have a very good variety of potential therapies for patients. And this is important because we are treating patients, not treating disease. And patients are different from each other. And so the physician has to consider or weight different aspects from the patients, the quality of life, as Antonio mentioned, as well as the disease burden, as well as the side effects that different drugs or different medicines might have on the patient. So these are all different aspects that should be taken into account when deciding the better therapy for a given patient specifically. And we can also consider not only these novel therapies to inhibit complement, as Antonio said, but we have discussed, and Dr. Camilla Frieri made a very good talk on the use of bone marrow transplantation for patients with PNH that should still be considered for specific patients depending on how the disease develops. The better thing that we could offer for patients is to cure PNH, right? This would be the ultimate goal for physicians as well as patients. And I think that we had some insights on how the disease develops and how we can curtail or even eradicate the bad cells from PNH that are in the patients. And for that, we had some information on the genetics behind PNH. So this is one important aspect. But also, I think that in between, we have novel potential therapies and potential targets that might broaden the arsenal for physicians and hematologists to treat these patients.
Yeah, I fully agree with you, Rodrigo. Actually, I would start saying that the future is just now, is today. And what we have been able to do was really impressive because we are changing treatment goals for PNH. And I think this is a very important message, not only for patients, but also for physicians. Of course, we are able to personalize medicine. We know that there are some factors that may account for suboptimal response to the standard treatment, and this was discussed by Pedro Prata, who dealt with inherited predisposition that may account for different response to treatment. But we went also in the details of the biology of complement with Ron Taylor, eventually dissecting the mechanism that may account for heterogeneity. This is very important because, I mean, without this information, we cannot know how to best use the weapons that we have in hands, let's say the standard one that were discussed by Maura Griffin and the novel ones presented by Regis Pefot de la Tour. I would end saying that at the moment, PNH was characterized by anemia, transfusions, and at the moment, we are completely changing our view of the disease because we are not just trying to avoid transfusions. We are trying to keep patient alive first, with the disease okay, except the possibility of a cure with transplantation, but we may have patients living with the disease without any symptoms and with very limited sign of the disease, hopefully even with normal blood counts. This is our current goal. This is not the future goal. Of course, how to deal with this in the daily practice with each individual patient is challenging. We are collecting all this information. We are working on that to deliver to treating physicians all the background to best treat any single PNH patient.
In the last decade or two, we have radically changed the way that patients with PNH were treated. And the quality of life has improved dramatically. And every year, we do have different options to understand better how the disease works and how to face that and how to treat patients. And I'm sure that patients do way better today with the therapies available than they did 10 years ago or 20 years ago. But we still have a long road ahead, and I think that I hope that in 5 years, patients will do way better also than they do today.